back with Dr. Theocharides. Dr. Theocharides, let's talk about wrinkles. Removals of wrinkles. I have heard there have been major improvements made on how that can be done. Tell us about it.
In the past, we did a complete removal of the various layers of skin, which were great, but you had general anesthesia and you had weeks of recovery and months of redness. Well, now the newest technologies remove a fraction of the skin, so the normal skin around it makes for quicker healing. We get still a lot of new collagen for tightening, wrinkle reduction, and even acne scar removal. So people are getting excellent results with one or maybe two treatments and much less recovery.
Wonderful. What's that treatment called, by the way?
It's called fractional resurfacing.
I see. And more or less, how does it work? In a layman's way.
Think of your skin like a lawn. If you remove the whole layer of grass, will new grass come back? Sure, it'll take a long time. But if you punch like holes the size of a pencil and get air into those areas, the grass will heal much more quickly. Well, when the laser does this microscopic drilling, we're talking about holes that are very, very tiny, and we measure them in hundreds of microns. What happens is it stimulates new collagen. The scar or wrinkles are kind of eaten up, so to speak, in layman's terms. And so the whole recovery process is just a few days, and people are looking with much more refreshed, brighter, tighter, smoother skin.
So, and when you say a couple of days recovery, does that mean having to lay in bed and cover over the head so that nobody sees you or you're unconscious? Or does that mean you could go to work but maybe don't really want to? Or what's the deal?
Very good question. We really can tailor this with the latest technologies, depending on the amount of energy we dial in and the number of these microscopic drillings per square inch, so to speak. We can actually tailor a recovery to suit the patient. Now, when we say recovery, there's no downtime. We call it no social time. That means that for the first, usually at least a day or two, maybe up to 4 or 5, you have to put a salve on. It's like Vaseline to cover up the face as the new skin is regenerating from within. It looks like a bad sunburn. Most people, if they're really going to get an impact to improve wrinkles, will not want to be seen by coworkers at least for a day or two.
Okay. So doing it on a Thursday, don't go to work on Friday, be off Saturday, Sunday, Monday, you're like pretty much back to normal.
Absolutely. Now, frankly, to get the absolute best wrinkle reduction and impact, with what we can do with local anesthetic on the skin, I would say 6 days is best to get the deepest. Now, someone who cannot do that, we can do a couple of lighter treatments that will give almost the same benefit as a deeper treatment and just take the 3 or 4 days, as you mentioned, the Thursday to Monday. But if people want to get one treatment, the biggest bang for the buck is when you need to take a couple more days.
And when you say the biggest bang for the buck, you literally mean bang for the buck, like in terms of dollar, meaning if a person wants to have less social downtime, let's say only 3 days the weekend versus 6 days, so he comes twice, is his expenditure twice as much exactly?
Not exactly twice as much. If a person can tell me, doctor, I have as much time, I'm retired, I can take as much time as you need, I will do a fairly aggressive treatment, do multiple passes, especially in particular areas. If there's a particular wrinkle in one area, I can do that a few more times, knowing that the person can afford to take a few extra days of recovery. Now, a person who says, well, doctor, I've only got 3 days, got a very busy schedule, I still have to do the whole face. Now, I won't charge him half of a complete, full deep treatment, but probably about 2/3. So a person who gets 2, milder treatments will probably pay a little more than someone who gets a single deep treatment.
Right, I understand. Now, if a person gets a single deep treatment and has 6 days of recovery, is there also more discomfort for the person during those 6 days than otherwise?
Good question. Well, it's usually about the first day that is the most uncomfortable, or even the first half day, where the skin is just very red and it feels like a bad sunburn. It feels like I heard one person say, it feels like I want to stick my head in the freezer. But we do have medication for pain if that's necessary for some people. But usually it's more of a maintenance. You have this Vaseline type cream called Aquaphor on your face. Once or twice a day we kind of wipe it off. Wash your face very gently and then put some Aquaphor on until the whole face clears up. It's usually the most discomfort is the first day.
Okay, I got it. All right. And, okay, good. So, and there are no side effects like, that once it's gone, a year later, your skin is even more wrinkled or so. And by the way, since I say a year later, how long does that stuff last? 2 months, 6 months, 9 months, 3 years? What are we talking about? On an average, of course. We know that different bodies probably act different.
I would say I would measure in years, 1, 2, 3 years, realizing we're continuing to lose collagen every year. It's not like one treatment and you're good for life. Even a facelift does not have a lifetime duration. Even the most aggressive under anesthesia procedures do have a limited span. Nothing is permanent.
No, even the denture, you put in a denture and the jawbone keeps shrinking, and that's why 2, 3, 6 years later you have to replace the denture. People think that the denture was badly made. No, it is their body which changed, and there's nothing you can do about it because the denture, the plastic or whatever it is, stays the same. So, okay, so years. And if a person after those 1, 2, 3 years, 4 years, whatever, says, hey, my wrinkles are coming back and I don't like it, can he do it again? Or is it kind of like a heart surgery where it's like, hey, we had one, we don't want to do another one?
Absolutely. There's really no number of a limitation. In fact, I've had people that have had several of these done, and they'll get a maintenance one maybe every 6 months. Not maybe as a very deep one, but they could do that. Definitely. The more, there's no lifetime maximum. That's the good news.
Beautiful. Very last question. Can you make a cute guy out of me?
You're pretty cute as it is.
Thanks a lot.
My pleasure.
Very, very informative. Very informative. I'm sure people will like it out there.